Okay, hi. Just for time's sake, we're going to get started. I just want to take a moment to introduce myself. My name is Randy Bell. I'm a licensed social worker and the assistant director for NJ Forest Compass Monmouth at Preferred Behavioral Health Group, and welcome to our Compass Academy. Compass Academy is a webinar series with the purpose to help support parents, caretakers, and youth by sharing prevention and mental wellness information. If you prefer this webinar to be transcribed in another language, if you just go into the chat, there will be instructions there. So just a little bit about NJ4S. We are known in Monmouth and Ocean County as Compass. So if you hear the term NJ4S Hub or throughout the state, just know that in Monmouth and Ocean County, we are Compass. So NJ4S was launched last year by DCF to meet the needs of students and families through prevention and mental wellness programs and resources. What we're trying to do is fill in the gaps to ensure that all students and families' needs are being met in the community. Tonight's webinar topic is navigating the treatment space. So this will provide information on how to navigate conversations with kids, boundary setting, natural consequences, and positive reinforcement. The presenters will discuss when it's time to get help, the importance of family involvement in treatment, and matching treatment type levels, type at risk level. So our speakers for this evening are Dr. Linda Richter, Corey Hammond, and Rachel Chernick, and they are from the Partnership to End Addiction. So welcome. We're very happy and excited to have you here tonight. The webinar will run for about 1 hour, and we will save some time at the end of the webinar for any questions that you may have. So thank you. We'll hand it on over.
All right, let me pull up our slides and we'll get started.
Rachel, I'll just give a quick intro before. So welcome everybody. I'm Linda Richter from Partnership to End Addiction. Corey, you can go to the next slide, please. So I just want to introduce our team for those of you who aren't familiar with us yet. So for those of you who are, you probably know me. I'm the Senior Vice President of Prevention Research and Analysis of Partnership. We have Corey Hammond with us, who's the Director of our Prevention Services. And we have Olivia Rood, who is a research assistant who helps us with these presentations and a lot of the work that we do. She's not presenting tonight. And we're really pleased to have Rachel with us today as part of our team. So Rachel is, Dr. Chernick is the Senior Vice President of Family Services and Evaluation Research at Partnership. She's been with us for a long time. She has many years of training in clinical work, teaching, and research experience in the addiction area. And her primary focus has been on adolescents and adults struggling with problematic opioid use. She has worked as the program director of the opioid treatment program at the Addiction Institute of New York at Mount Sinai Hospital, and as a clinician in a variety of direct care services in New York City. She's taught at the Silverman School of Social Work at CUNY Hunter College and worked in the research units of New York City's Department of Health in the Bureau of Drug and Alcohol Prevention, Care, and Treatment, and at Columbia University School of Public Health. And in her current role, Dr. Chernick provides programmatic and clinical oversight and leads research and evaluation activities for our family services. She also serves as a subject matter expert on issues related to opioids and treatment for substance use disorders. So we're really fortunate to have Dr. Chernick joining us tonight because this is her true area of expertise, and I think you'll all really enjoy hearing from her. And I'll pop back in toward the end.
Thank you, Linda. It's great to be here with everyone tonight. This is, as Linda said, this is an area of work that I've been involved with for many years and hope to be able to share some of that knowledge with you tonight. Would love to answer questions. I want to make this really relevant and useful for you. So I have a presentation ready, but along the way, if I missed something, or if you have a specific question about a particular area that is of interest to you, just please put the question in the chat and I will try to get to all of them either during the conversation or at the end. We want to make this really useful for all of the participants. So tonight we're going to cover a few basic topics. We are going to talk about having difficult conversations with your kids about substances. We are going to talk a little bit about when it's time to get outside help, when a problem is too big to handle within the family. We will cover different types of treatment that are available in the addiction treatment space, how families can be involved and stay involved in treatment if their children do need treatment. And also, we are going to share all kinds of resources that we have here at the partnership for you, as well as some resources available for residents of New Jersey, specifically, that will help you if in fact you do need to access support around this issue. So we are going to start with a little bit of just some helpful information about how to have tough conversations with kids. This is really where we recommend starting. And if you go to the next slide, Corey. So as an outline for this presentation, we're going to use something that the Partnership to End Addiction calls our treatment roadmap. So it's really a very helpful tool, and we can put the link into the chat for you all to find. And it'll also be, it's also included on the slides. I know you'll get the slide deck after the presentation, but it's really literally a map of how you can walk through this process. It helps guide your steps along the way, and it's just helpful for parents, especially if when they are navigating something that feels unfamiliar, that they may not have had any experience with. And we hope it'll be a useful tool, and we're going to use it, as I said, to guide this presentation today. So the first thing, as I said, that we recommend doing, if you have concerns about a child's substance use, is starting with a conversation. And if you have already had this conversation or several conversations about this topic with a child, that's fantastic. If you haven't, then I'm going to share some insight here. And even if you have already had conversations, there may be some useful information here that will help if you need to discuss this additionally with your child. So if you go to the next slide, we think about conversations with your kids really, I think about them as something you would prepare for, sort of if you were going to have a conversation with your supervisor at work about some kind of a difficult topic, or a conversation with a family member that you were concerned about, not even a child, a sister, a parent. You don't have to launch into this without preparation. In fact, I think preparing yourself in advance and kind of getting your thoughts organized and developing a plan can be really helpful, because these conversations are very emotional, and they're emotional for the parents. They can be very emotional for the kids, and it's just nice to go into it with sort of a clear head and some clear thinking around, and be prepared as possible for what might happen. So these are kind of three main things you can organize before you start a conversation. If you go to the next slide, I'll just talk through each one. So the first one is really observing. I mean, you've probably been doing this, otherwise you wouldn't really think about having these conversations, but you have been observing and continue to observe changes in your child's behavior, which is what brings you to this conversation, right? So you may have noticed changes in mood and personality of your child. You may have noticed behavioral changes. So performance at school or lack of interest in extracurricular activities. You may notice changes in hygiene and appearance. So maybe there's a weight gain or weight loss. There may be uh, a, a different way of dressing or less hygienic care. In terms of physical health, there may be chronic illnesses or just lots of uh, pains or aches, or just in general, like a child that doesn't seem to be particularly healthy. So you are noticing these kinds of changes, and they're concerning. You may not have identified that these are specifically related to substances, but these are things that sometimes can indicate an issue with substances or some kind of substance use. You will also, hopefully have a conversation with, if you have a partner, a conversation with your partner about how you're going to approach this conversation. And it's important to get on the same page as your partner. It doesn't mean you necessarily have to agree about how you feel about the issue, or even agree about how to proceed in terms of all of the strategy. You don't have to be all lined up 100%, but when you're speaking with your child, you want to present a united front. It's really, really important for the child to know that you and your partner are on the same page in front of them. And it's really a stressful situation, and you need each other, right? Again, if you are partnering, if you have a partner and are parenting with a partner, you need to lean on each other, because these can be very emotionally difficult times. And just some things to remember to keep in mind as you talk to your partner about this and prepare for conversations with your kids. No one is to blame. Nobody caused this. It's nobody's fault. Often the first thing you do is, oh, well, if you hadn't done this, or if you hadn't let her do this, or, it's very easy to start pointing fingers. And it first of all, it doesn't help. And secondly, nobody is to blame. Every parent does the best they can in raising their children. Nobody is trying to, support a substance use issue in their child. We all are, trying to do right by our kids. We love our kids, and we want what's best for them. So it's really important to hold on to that. We're all doing the best we can as parents, and parenting is really hard work. And nobody has all the answers. As they say, there's no manual that they give you when you bring the child home, with you. So again, everyone's doing the best they can. So yes, you'd want to come to an agreement on, at least on the position you'll take in terms of interacting with your child. You really want to try not to undermine your partner, at least not in front of the child. If you need to argue and disagree with each other, you can do that in the privacy of your own relationship, but try again to have a united front in front of your partner. And always come from a place of love when talking to your child. And this is easier said than done. It's really hard to get angry. It's really hard to be judgmental. It's easy to go down that road, but the more you can hold on to a loving stance, the more effective the conversation will be. And then the other thing we talk about is also just setting up some goals. So in your head, what do you really want to get out of this conversation? And again, this may be one conversation, it may be a series of conversations, depending on if this is a smaller problem or a bigger problem. And so you don't have to accomplish everything in one conversation, but you may want to set a few goals. And, these are just a few goals that I thought of as I was preparing the presentation. Sharing love is always the right thing to do, right? No matter what happens and no matter what your child has done, you always want to share the fact that you love them despite their behavior. And you know, you may want to take an opportunity to clarify your expectations. This is okay in my house. This is not okay in my house. You may want to reset boundaries. You know, I'd like you to be home by this time, or I'd like you to call me if you're going to be doing this, or I want to know where you are, things like that. And, you know, sharing concerns is usually part of this conversation. I just want to make sure that, you know, in this conversation, I share that I'm concerned about A, B, and C. So I'm concerned that, you know, you came home too late, you know, after your curfew one night. I'm concerned because, you know, your eyes seemed really bloodshot, and, you know, you seemed like you might have been intoxicated. And, and I'm concerned because your grades seem to be slipping this semester at school. So sort of these are the things I've observed, and that's what I want to just share with you today. Okay, so this is sort of, you know, as a conversation begins, you know, these are just some of the reactions that your child may have. It's not always, not every child, not every scenario, but one of the things they might say is, you went through my stuff, you're a snoop. And this is if in fact you found some kind of evidence of substance use in their room or on their phone, or in some way, you know, found some kind of proof that, or some kind of evidence that there may have been some substance use happening. So the first you know, the first reaction to that often is, you went through my stuff. So my advice to you here is you remain calm. You know, that's, you know, it's easy to get defensive. It's easy to start saying, no, but I'm the parent and I'm allowed, you know, and you know, remain calm, take a deep breath. You can defend your choice to look through your teens' things by expressing your concern for their health and safety, reminding them that you are the parent, that you're responsible for them and for their well-being. And and unfortunately, you had to break their trust, but in the end, your first and most important job is to keep them safe and healthy. And you may have to sometimes do things that they disagree with in order to keep them safe. Another common reaction, you smoke and drink, you're such a hypocrite. You know, like, how can you tell me not to do something that you do? So again, first suggestion, remain calm. This is this is always my first suggestion. And then you really want to focus on the issue that you are bringing up in terms of your child's using substances. They are trying to sort of turn the tables on you and put you in the defensive. And the fact is, your teen should not be using substances. It is illegal for them to use substances. In fact, you as an adult are allowed to smoke and drink legally in this country. And not only that, but you may have regrets over your own decisions. You know, I wish I had never started smoking. It's hard to stop, and I'd like to prevent you from going down that same road. The next comment is about this legality. And, you know, we always at the partnership talk about brain development. It's a really big focus of our prevention efforts. You know, adult brains are really different than adolescent and young adult brains. In fact, young adult and adolescent and young adult brains are not fully developed until they're between the ages of 25 and 30. And so using substances at a younger age has a different impact and can interrupt normal brain development in a way that it won't do if you are an adult with a fully formed brain. So it's different. It is different for an adult to use a substance than for a child to use a substance. If you yourself are in recovery, this can be tricky sometimes, because a child will say, well, you did this when you were a kid, and you know, your substance use was worse than mine or something. And look, you can just say, I mean, if you are honest with your child about your recovery, you can just say, I really love you. I really don't want you to go through what I went through. My substance use and my recovery was really hard. My substance use, the time I was using, was very painful. And I don't want you to ever have to go through that. Which is, you know, I'm sure an honest reflection of how you feel. Okay, another comment you might get, I didn't do it. You know, just denial up and down. I don't know what you're talking about. I didn't do it. So remain calm in your reaction. Try to stay focused on your goal. It's not you know, you don't want to get into a gotcha kind of situation like I didn't do it. Well, yes, you did. I didn't do it. You know, yes, you did. It's like that's kind of a power struggle. It's not going to go anywhere. I would just try to reframe your concern. You know, okay, you know, you're saying you didn't do it. I see a lot of warning signs. I'm really concerned about some of the things I've observed. I really love you, and I'm not going to get mad. I'm not going to punish you. I really want you as much as you can to be honest with me about what's going on. There's just some strategies in how to handle typical responses that we see. Okay. Some of the other things you may want to remember to do during a conversation or conversations about substances. So again, keep calm. This is your child's health and well-being. And again, you're the parent, and this is your responsibility to ensure their health and well-being. I talked about coming from a place of love, being direct. You know, and you can, you know, just be honest. This is what I'm seeing. I saw this. I mean, this is what I'm observing. It's sort of, you know, there's no point in beating around the bush. This is in fact exactly what I'm seeing. Withholding judgment is different. So this is what I'm seeing is different than this is how I feel about what I'm seeing. So I saw you come home late. It was, you know, 2 o'clock in the morning and you seemed intoxicated. That's a direct statement. How I feel about that is different. I'm angry at you. I was worried about you. I'm furious that you broke curfew. You know, I told you not to hang out with those friends and you did anyway. That's different. And I would hold off on all of that, because judging them is going to push them away at a time when you actually want to encourage closeness and honesty, and the judgment is likely to shut somebody down. You want to just listen as carefully as you can, and really, really as much as you can, try to understand the perspective. You know, I wanted to go out with this group of friends because of this, or I really, you know, feel like this particular person is, I don't know, I got backed into a corner and I had to sort of, do something with this particular person or handle the situation this particular way. Asking about the why or being curious about the why, you know, sort of for someone who maybe has been using more often. We often at the partnership talk about how behaviors make sense. So substance use is often not an isolated action. There's often an underlying reason. It can be a desire to medicate a certain feeling of anxiety or fear or depression in some cases. It can be about desire to connect with peers. It can be a need to experiment, experience new things, kind of risk-seeking behavior. So understanding where the behavior is coming from and being curious about it, is exploring that, I think, is really is always a good thing to do. And sharing expectations, we talked about that. So this is what I expect from you. You're, living in my house. You're, my, child who's dependent on, you're my dependent essentially. And this is what I expect, from a child in my care, essentially. Things that you shouldn't do, on the other hand, really avoid a conversation if your child is under the influence. It's hard to have a productive conversation if somebody's high or drunk. You don't want to have a conversation if somebody is on their way out the door to school or to visit a friend. You don't want to have a conversation right before dinner, right before bed, or before dinner. We talk about hungry, angry, lonely, or tired. The acronym is HALT. Those are those are times to avoid having a conversation. If someone's hungry, angry, lonely, or tired, you want to try to have everybody be in an emotional space that is conducive to having a productive conversation. try not to get defensive. Very hard, much easier said than done, but you really try to avoid being defensive. At the same time, you want to take what your kid says at face value. It's unlikely they will be 100% honest about things that are happening, especially if they feel like you're going to be angry or judge them or punish them. So there's always sort of a grain of salt. It's like, okay, I hear what you're saying, but in your mind, like, okay, I'm just going to file that one away, but I still have some questions about that. Do not answer your phone during this conversation. You really want to make sure that you are 100% present and available. Okay. So, you've had a conversation or a series of conversations, and it's becoming increasingly clear that whatever the substance issue that's happening with your child is too big or too complicated or more severe than you really know what to do with at home, or you're just frankly not sure if what's happening at home is really a problem. And so you want to get some outside help. You want a professional to sort of weigh in on whether or not this is something to be concerned about. Okay, so this is really scary, obviously, to think about your child having a problem that warrants some kind of outside intervention. But this doesn't necessarily mean you're packing them up and they're going to rehab the next day. Often people think about rehab as sort of the only kind of treatment for addiction, and that is far from the truth. What you really want is to find someone who can give you a good professional evaluation of the current situation. And this should be a health provider who has experience both with young people and with substance use. So it could be a therapist, a psychiatrist, even some pediatricians who have expertise in addiction might be able to do this. And you can either talk to your child's pediatrician and get a referral from them, or you can look online. And we just want to make sure that when you look online, that you're getting information from reputable sources. As soon as you Google addiction, teenager, weed or pills or alcohol, you're going to get a whole bunch of links to for-profit treatment programs that are not always reputable. They do not always have the best interests of your child at heart. So we suggest that if you do want an external advice or an evaluation, that you go to one of the following places. So the first place that we recommend is the findtreatment.gov website. This is the federal government runs this website. It's for any treatment anywhere in the country. I know most of people here in New Jersey, but if you live somewhere else or you might be looking for treatment somewhere else, this is a good place to go. These are the government, the SAMHSA, which is an organization it's part of the federal government that is in charge of essentially substance use treatment in this country, oversees substance use treatment in this country, vets all of these programs, make sure that they are licensed and legit, essentially. So any kind of resource you find here has been vetted by the government. So you can go to this website and just type in, I think you type in your address, maybe your zip code, and you can look for certain parameters that you're looking for, like age or a particular substance, or I believe you can put in your insurance, kind of insurance you have. The next resource is specifically to people who live in New Jersey. It's a phone number. You can call 1-844-REACH-NJ. And I believe you can either call this number if you want to just have somebody help you with this on the phone, or you can go to this website, which we will provide for you. And again, you can put in your zip code and what county you're in, and they will the website will pull up resources that fit your search criteria. So this is New Jersey specific. The next one is another resource available to people who live in New Jersey. This will actually help you not only locate, what treatment is in your zip code or in your county, but it will also help you figure out what the right treatment is for you. It's a website run by the Shatterproof organization, which is a nonprofit organization, and their interest is helping you figure out what treatment fits your needs. And they ask you a series of questions, and based on your answers, they will tailor responses. So another really great resource. And then finally, we often refer psychologytoday.com website. This is much more geared towards mental health and psychiatric care. So, but they have a lot of addiction providers here as well. So if you think you want to start with a therapist, which is not a bad place to start, and you're looking again for a therapist that has some addiction expertise, you may find somebody here on the Psychology Today website. So those are 4 places that we trust, that we refer parents to all the time, where you'll get reputable information. Okay, so what happens next? So you find a provider, and they will meet with you and will meet with your child, and they are trying to figure out whether your child has a substance use disorder, and if so, what's the severity of that disorder. And so they will ask a series of questions. They will assess across 11 particular symptoms, and the answers and how you score on these symptoms will provide a diagnosis of either mild, moderate, or severe substance use. Sort of depends on how many criteria the person has. I'm not going to go through all the criteria. Again, you'll be able to get this information. We'll share it with you in the presentation. But the main point here really is that a substance use disorder, which is essentially the technical term for what we familiarly known as addiction, we kind of say somebody has an addiction. And the technical term for that, which is substance use disorder, is essentially a disease that is characterized by the continued use of one or more substances despite serious health and social consequences. And that's really the thing that someone who is evaluating your child is looking for. Is it ongoing use of either one substance or more than one substance despite health and social consequences? So even though they're, doing poorly in school, even though there's ongoing health concerns, even though there's disruptions to family relationships, friend relationships, there is a continued use of substances. And and part of this is because there's a physiological process with addiction that essentially interferes with decision making. That's sort of normal decision making, that somebody would say, hey, I don't want to continue doing this activity because I understand that it's having these kinds of negative consequences. And addiction interferes with those parts of the brain that are responsible for making the decisions, sort of healthy decisions. And another important point to make is that regardless of whether there's a substance use disorder that is diagnosed as either mild, moderate, or severe, substance use disorders are highly treatable. We have lots and lots and lots of tools, and more tools every year that can treat substance use. So the earlier if earlier you can get intervention and take steps to help your loved one, really the better. You don't want to kind of bury your head in the sand on this one and sort of cross your fingers and hope it goes away. It's better to find out that, there's not such a big issue, to kind of talk to a therapist or have a consultation and find out, hey, in fact, this isn't that severe. It's better to err on the side, I think, of concern than to err on the side of, there's no problem here. This will just go away by itself, because the longer the substance use happens, and in general, the harder it is to treat, the more intractable it becomes. Okay, kinds of treatment that are available. So here's our treatment roadmap again, where you can sort of see at sort of this juncture in the roadmap, we are exploring options about what kinds of treatments are out there. So at this point, you have a child who's using substances, a practitioner has diagnosed them with, say, a moderate substance use disorder. And the next thing to do is figure out, okay, so what kind of treatment will fit my child the best? So there's different levels of care. If you go to the next slide, yeah, thanks, Corey. So again, it's not all just send them to rehab. There are levels of care, and starting on the left side of the screen is the sort of the least restrictive care all the way to the right side of the screen, which is the most restrictive care. So the level of care that your child needs will really depend on what substance they're using, how long they've been using it, whether or not they've been in other forms of treatment, and this is their second round or maybe their third round, whether they're dealing with a mental health issue on top of an addiction issue. So lots and lots of factors go into what kind of level of care you need. But in general, there's sort of an outpatient level of care, which is low intensity, maybe up to 9-10 hours a week. The child lives at home, but goes to either online or goes to a facility to get support from a therapist, from a counselor. Perhaps there's group intervention, perhaps there's individual sessions. An intensive outpatient program involves the child living at home, but it's more intense, as the name says. Sometimes we call this an IOP. That's maybe 10 to 20 hours a week. It's for a more severe substance use disorder, so the intervention is more intense, more hours a week. There's a partial hospitalization program, which is sort of next level of intensity, 20 or more hours a week. The child is still living at home, but partial hospitalization, meaning it's almost like they're partially at home and partially in a hospital because of the amount of time they're spending in a treatment facility, spending days there, going home at night to sleep, but lots of time in different kinds of treatment activities. A residential facility is a high intensity kind of care. This is what people generally refer to as rehab. When they say rehab, they mean a residential facility. These can be 1 month long, 2 months, 3 months. Sometimes these are 12-month programs, 2-year programs. They really depend. But the idea is you remove the person from their home and take them to a new location where they can really 100% focus on their recovery, and you sort of remove them from all of the things that might be contributing to ongoing substance use if they're continuing to live at home. And an inpatient facility is really much more hospital based. So there's likely more of a medical component to this. There may be, be some requirement for medication as part of a detox. And you're living in a hospital or a medical type facility in an inpatient stay. And generally these are a little bit shorter, but yeah, sometimes people refer to this as detox. It's a medically managed treatment encounter. Okay, so that's kind of levels of care. Just some other information that might be helpful. There's all kinds of care that you might get in a treatment facility. You can go to the next slide, Corey. So in any of these treatment facilities, whether it be outpatient or partial hospitalization or inpatient, you will get some combination of these kinds of care. So you might get group counseling where your child is in a group of 6 or 8 or 10 people and a counselor talking about, substances, talking about coping with stress that comes up, talking about all kinds of, issues that are related to substance use. There may be family services involved. So there may be sessions with families over the Zoom or in person There may be separate counseling sessions with the family members. Mental health treatment. So mental health, there's often what we would call a co-occurring issue between mental health and addiction. So mental health issues and addiction issues often travel together. They're sometimes a mental health treatment, sometimes a mental health issue will lead to a substance issue where the person is self-medicating, trying to use a substance to address a mental health symptom. Sometimes a substance use disorder can cause mental health symptoms. In other words, people might feel concerned about, might have a, feel depressed in, reaction to taking a substance, or might feel anxious, or there may be psychotic symptoms that are a result of substance use. So sometimes it's hard to detangle what comes first, a substance use issue or a mental health issue. But either way, we will guide people to addressing both at the same time. It's hard to address a substance use issue and leave out the mental health issue, and vice versa. So if there's a mental health issue, getting mental health treatment at the same time, and hopefully integrated into the addiction treatment, is really, really important thing to remember. Sometimes people are offered vocational educational services, integrated into programs. If kids are away, sometimes there's a school component to the program. Individual counseling is often part of addiction treatment, and medications for addiction treatment are also often included. And depending on the substance that is of concern, it's possible that there's a medication that will help support recovery from that substance. Unfortunately, there's a lot of suspicion around using medications in substance use treatment. If a healthcare provider recommends medication for your child, please, be open-minded about that and learn as much about it as possible so that you can make really a good decision about whether that's the right decision for your child. There's a lot of evidence that shows that medication can really, really help support treatment, and we don't want people to just reject it because they're misinformed. Okay, I can see it's already 7:15, and I want to make sure we get enough time to go through the whole presentation. So finding a provider is we really talked about this. I gave you those resources for how to access providers that are going to be reputable. And the final point I really want to make is, if all of this feels confusing, or I just dumped a lot of information, it feels overwhelming, or like you still have questions, it's still not clear where to go, please contact our helpline. We have a free and confidential service exactly designed for families who have these questions. Is it time to send my kid to treatment? How do I talk to my kid about substances? I don't understand how to navigate the treatment process. So please reach out to us. You can text us. You can text connect, the word connect, to 55753. I'll put this in the chat. You can call us to schedule an appointment. We have trained clinicians who will answer phones and share a wealth of information with you. They're compassionate. They're non-judgmental. Nobody will, judge you or give you a hard time about calling. It's really a safe place, and it's a lovely service. So please don't hesitate to contact us. And I think I'm at Linda's section.
Yeah. And I wanted to say just real quick before we switch over, Rachel, there was a good question in the Q&A from Kim, who asked, for substance use treatment, does someone always need a referral, or can a family member call directly for help?
That depends on your insurance I think that's really something that you have to talk about with your insurance provider. I think it really depends on what kind of insurance you have, whether or not you'll need a referral or whether or not you can go directly to the provider.
Great. Thank you, Rachel, so much. I just want to talk about one component of the treatment process that doesn't get talked about enough, which is once your child finds a provider or is in treatment, the thinking is that, okay, parents get out of the room. It's like the focus is directly on the child. And what we have found and others have found through years of research and through our own work is just how important it is to have continued family involvement, parental involvement, caregiver involvement in this process in terms of it being a really effective process for the young person. So one thing to just note is we often talk about parents and we kind of throw that word around casually, but we know that not every family, it's the parent who's taking care of the child or that there even is a parent involved. So we often say parents and other caregivers, and we talk about the loved one, because it's not always the child necessarily who the person's taking care of, but essentially when we talk about families at our organization and in all this work, we're really talking about anyone who cares for someone else who is at risk for using substances or who is currently using substances. So it could be any of these people. So once somebody has started treatment, what's really important to understand is that the parent, the caregiver, the person who's involved stays involved and can be connected and aware of everything that is going on and be able to kind of help the child navigate through that system. So, here's just like a little tip on the bottom that the child or the person who's receiving the treatment does sign a release form so that the family members could stay involved and understand how to best help. It doesn't just, like I said, you don't just drop the child off of treatment or into the therapist's office and that's it. The involvement of the parents and caregivers is really important. Next slide, please, Corey. So one thing we know is that families not only, for their own sake may want to be involved, but they're actually a very underutilized tool in effective treatment for young people especially. And most treatment for substance use disorder or recovery support services just focus on the individual, him or herself, and kind of keep the families out of it. And that's partially because of how the insurance model is set up and how our treatment system is set up. And not only do they kind of keep the caregivers out of the child or the youth's treatment, but they also completely disregard the needs of the family, the parents and siblings, or other caregivers in this treatment process. And you may have heard people talk about addiction as a family disease. That's very common to hear, and there's a lot to that because it clearly affects the whole family. The reverse of that is how important it is to have all the family's members' needs supported within this treatment process so that they can all facilitate the young person's care and recovery and also ensure that sort of the family stays intact in a healthy way. We know that families have been forced to play a pretty informal but essential role to kind of fill in the gaps that the treatment system often doesn't provide for the young person. And they often don't receive the kind of interventions that are actually based in research evidence to provide them with the skills that will facilitate not only the young person's, health and recovery, but also that will help them help that child or that loved one go through the process. So you've seen this continuum of substance use sort of before when Rachel was talking about it, but we know that there's a lot of research showing that when families are empowered with information and support, they can really influence their loved ones' substance use along every point of this continuum, whether it's preventing substance use, intervening early with substance use, helping someone who is already struggling, definitely facilitating the treatment process, and definitely ensuring that recovery process is healthy and effective. And there's just so much research on this. We have documented the research on it because it's something that people don't pay close enough attention to. And it's a big emphasis of ours is the family's role in this whole process. If substance use is not like the same thing as if a child, let's say, breaks their arm and you kind of take them to the orthopedist, have it mended, fixed up, and then they come back home to you and, there you go. It's a pretty intensive process. And the more support that the young person has from the family, the more effective it will be. So for those individuals who are able and willing to engage in treatment, there are family-based interventions, which include a whole range of family therapy models. And there's a lot of evidence to support the effectiveness of these family therapy-based treatments, in addition to the individual's own treatment. So as you see here, research strongly supports family-based approaches for adolescents, especially. What family involvement does is it increases treatment entry for the young person. It enhances their completion or ensures that they'll stay with it. And it certainly is linked to better outcomes for the young person, so that the young person's not going it alone. And it sort of is a therapy for the whole family to sort of change the dynamics or support the youth into recovery. And there are many studies, but there's one large-scale study that found that 5 out of the 6 treatments that have been identified as effective for adolescents, all involve family-based interventions or include the family in the treatment process. One approach that we use a lot in our services, and that others do as well, is something called the community reinforcement and family training, or CRAFT approach, which is an approach that, it's focused on families who have a loved one struggling with substances, who may not be very interested in getting the care that they need at that point. So what this approach does is really educate parents and other caregivers about how to communicate with the young person, how to support them through this process. It's very difficult to do when somebody is resistant to getting treatment, or may not feel that they need it, or may not be ready to get it. This approach gives really concrete and practical tips and tools for parents and other caregivers in terms of how to have those conversations, also how to take care of yourself as a parent or caregiver, because anyone who's been through this knows just how draining and all-consuming it could be. And to really facilitate this change process. So the older method, and something many of you may have heard, is, either you can help them or you can help yourself. And if you're just going to help your child, then it's going to drain you, and you have to distance yourself, and you have to kind of let them hit rock bottom, or you don't want to enable them, or you kind of kick them out of the home. And there's all these very punitive approaches that have been encouraged by treatment programs and in the field for many years, that essentially we're telling parents and caregivers, if your kid is resistant to getting treatment, then they're on their own. They have to just sort of suffer the consequences, and finally they'll realize it and they'll come back to you and ask for help. If you talk to any parent or caregiver who has been through this, it never sits well with them. That always feels wrong to them and unnatural. And there's a reason for that, because it is this kind of punitive model that we talk about a lot that may seem logical, but it actually doesn't work very well. And really what we want to do is find ways to set these limits and boundaries so that the caregiver or parent is not, dragged down the hole and kind of left with no energy, resources, or ability to live their lives or help their family, but at the same time facilitate their loved one's recovery. So this method teaches specific strategies about how to understand and communicate positively with a young person, even when things aren't going that well, how to use techniques like positive reinforcement, where you really focus on what is working and what the young person is doing well, instead of always focusing on the bad things that they've done, but at the same time allowing for what's called natural consequences. So if it's not something that's going to be extremely dangerous for them, if they, due to their substance use, don't show up to school or don't show up to their job, and they experience the consequences of that, you let them experience those consequences. But if it is something that's really severe, you do step in. So, I heard an example once of, when you're with a young child and they're walking on the sidewalk and they may trip over, a little bump and fall on some grass because they're running too fast, you may let them do that. But if they're running into the street with oncoming traffic, you're not going to let them do that. You're going to pull them back. So this is kind of an approach that really helps parents and caregivers facilitate health in their children. Another thing that's important to just realizes that once treatment is over, there's really an important need for continuing care. Addiction is often relapsing. So many times when someone, recovers from their substance use disorder, they may go back to it in certain circumstances. And that's not a sign of failure of the treatment process. It's not a sign of failure of the young person. It is just the nature of the disease. And what we want to make sure of is that the person has all those supports that they need to maintain their recovery or achieve recovery again if they have gone back to using substances. And this treatment roadmap provides information on that as well. And then once someone is in recovery, what's really important is to, use the family and ensure that the family maintains its connection through this continuing care aftercare process, because it's a really important element of effective substance use treatment for a young person. Unfortunately, only about a third of treatment programs offer good quality continuing care for the young people or for their parents. So this is something that we really want to emphasize again, that it doesn't just end when someone leaves a therapy or leaves a treatment, stay. It's kind of an ongoing process where the family support is really essential. We want to leave you with some really useful resources. As Rachel said, you're going to receive all of this and be able to access it, and we don't have much time, so I'll just kind of blow through these quickly. As Rachel mentioned, we have terrific personal support services for individuals who are at any point along the continuum with a loved one, with a young person. So whether you're concerned about, do I need to worry that my child's using substances, to does this person need treatment, or they're in treatment and I don't really know how to handle it when they come home or while they're home, or they need help with recovery support, all those things, we have a whole range of terrific resources about that. As you know, we may have shown this to you many times before. We have a whole bunch of prevention resources, guides, and tools. And you can go to the next slide, Corey. And many of those are in Spanish as well. We have a whole range of resources that we've now translated into Spanish for those who are Spanish speaking. You've seen us present this as well. We have a risk assessment tool, which is something that a parent or a caregiver could take for themselves to understand the level of risk that their loved one might be at. So this is not a diagnostic tool, but it is something that allows them to see, they have a certain number of risk factors for substance use or substance use disorder, and how concerned should they be, and what are some resources that they can look to address those risk factors. And this too is now available in Spanish. That's, on the other side, once an individual is already in treatment or in recovery, we have a whole range of services and resources there as well for how to support someone in that process. And again, these kind of personal support services are available not just on the prevention side and the treatment side, but for recovery support as well. And more of our resources are, as I said, available in Spanish. So here's some examples there. And then we also have, navigation treatment resources for how to create a plan for engaging with the young person who may need treatment and how to go from there. I do want to just take 1 second to talk about vaping. It's not usually considered, nicotine is not usually considered part of the conversation when we talk about addiction treatment, because usually people are focused on alcohol and other drugs and kind of exclude nicotine. A lot of young people are vaping and are addicted to vaping products. And I just want you to know that there are a whole range of really helpful resources out there. Most of those do not require someone being sent off to treatment or to a rehab. But there are a lot of very useful tools out there that are put out by the Centers for Disease Control and Prevention, which is a government agency, by the Truth Initiative, which is a terrific nonprofit that has great quitting resources. The National Cancer Institute has some, and the American Lung Association. So if your child is vaping and you're very concerned about that, please check out some of these resources. And I know we're at time, but if we do have some questions, Rachel and I could certainly stay in, Corey, and answer those.
Anyone have any questions? Oh, sorry.
No, I was just asking if there's any that we missed that may be in the chat. And Rachel shared a whole
Yeah,
bunch of
I can
our
put my camera on,
resources.
please.
Okay, well, if there are no questions, then I'm going to go and turn it over to Randy to wrap it up for the night.
Okay, thank you so much. You know, as a mom of 3 boys, 2 teenagers, and a preteen, this is something I certainly appreciate. I'm always looking for different ways to navigate these difficult conversations. You know, they're certainly not easy, and so thank you for all of those wonderful tips, Dr. Chernick. They were very, very appreciated. I just wanted to mention also there is a tool that we use, just another resource for parents out there, something called TAO. It is Therapy Assistance Online. It's just another great resource, another great tool for parents and for youth 13 and older. Just, you know, just another support. So, you know, Enza is going to put it in the chat if you're interested. Oh, it's right coming up. And then, you know, you can scan that QR code and you can sign up for yourself. So this is a survey. So if you can scan the QR code, you know, we're always looking for, you know, feedback, you know, how we can make things better, what we can improve upon. So please take a picture, and Corey, for this beautiful, informative webinar. This was recorded, so you can go on our preferred website and watch it, or send it to some people you think may be interested in learning more. And then we have another Compass Academy webinar next month. That will be April 24th at 6:30. And the topic is loneliness and social isolation and how to foster connection in schools and the community. So thank you again for your time, and have a great night.